globally, there is still quite an issue in regards to reproductive right violations, the coercion of forced sterilisation. Can you tell us about that and where this is being implemented?
Since last year, 2013, we are not heard or we not get any report for this forced sterilization. But this has happened since 2006. One by one, women living with HIV share their experience when deliver the baby. In that time also, we don't know this is part of violation. We thought this is the better for us.
Is it done under anaesthetic? Do they approve?
No, in the operation room.
Right.
So in the operation room, and then the doctor just come and then ask them to sign. Mostly happen like this when they are not well, and then the baby won't come out. And some doctor also, I don't want to do anything to you before you sign this. And the woman is so painful that time, and then okay, I will sign whatever, something like this. And then, or if I don't want to sign anything, and then they go to the husband or the family.
Right.
So this has happened until 2011, until we have data for that. And then since that time, we start to learn what is a form of violation. This is part of the violation of the woman living with HIV. So we need people respect of our right. We can make decision of our body, even though in Asia Pacific or in Indonesia we are patriarchal culture, but at least we have a voice for our own needs, want, and whatever. And then we start advocating since 2011 until 2012, and then we also part of Indonesian CIDO report, Committee Eliminate Discrimination of Form. And then since that time, people stop to do this course, and then we not heard any report, but the doctors still advise. You want to, this is part of family health planning. You're already positive, and then your partner also HIV positive, and then your economic also in low, and then how you can support your child. So they start thinking about how can live with this child, and my I don't have work, blah blah blah, something like that, and they decide to do that. But at least this is not forced anymore.
BEIRNE ROOSE-SNYDER, this isn't unique to Indonesia though. It's happening in countries around the world, and the only thing I can compare it to is the things that went on around single mothers here in this country in the 50s and 60s.
Yeah, it's part of, obviously, I mean, Baby and myself and our organizations view it as part of sort of a larger reproductive health and rights problem of the sort of the lack of belief that women are autonomous and can make good decisions for themselves about their health care and when they want to have children and how many children they want to have. It's sort of part of a much larger problem.
You mean being in control of their own bodies?
Yes, for instance. But it is unfortunately something that we have reports from around the world. Our colleague Tercia from ICW, which is the International Community of Women Living with HIV, yesterday was talking about some of the ongoing events in Kenya, investigations. They've taken it to the courts and sort of continue to use the court system. Many women finding out 5 years later, when they try to plan another pregnancy, that during the C-section of their last delivery, there was tubal litigation against their will, and that they never knew about, that no one ever told them. I think There's cases where it's being forced to sign, being told that they're going to withhold treatment or that the baby will die if you don't sign. Most people understand that labor is an incredibly vulnerable time. It's not when one does your clearest thinking.
There's a lot going on.
There's a lot going on. Women, we use the word vulnerability, and people, people sort of go, yes, of course. But when you really think about how much pain women are in, how tenuous the situation is with whether it's a C-section or whether it's a vaginal delivery, and thinking about forcing someone to sign something during that time with the promises of delivery or whatever afterwards. But then there are also just women who were never told and never signed anything, not under coercion, but simply without ever having knowledge of it.
Where's it coming from? Is it coming from governments putting pressure onto doctors to enact this, or is it seemingly altruistic doctors trying to do the best for their people in their eyes?
I'm sure Baby can give a rounder answer, but yeah. I think historically it's come from that sort of drumbeat of the 80s, the expectation that people weren't going to live, that this is HIV changes everything. There's a very strong expectation still amongst women living with HIV that you wouldn't choose to have sex again, that you sort of deserve to have a sex life.
How dare you?
That you don't deserve to have more children. That you're sort of a ticking time bomb, and so there is an expectation that the sexual part of your life and the reproductive part of your life should be over. And I think that's been codified in some countries and is just sort of it's still a medical expectation a lot of places, a lot of and it's reflected in HIV criminalization laws as well, that thought of you're done. You don't get to have sex anymore, you don't get to have that part of your life anymore.
Yes, that's true, but I can't say that the government put pressure on the doctor, but I think also maybe this is initiative from the doctor to eliminate the new HIV infection, but I cannot understand why, the reason they want to contribute to the country or the nation or what, to stop this elimination in this way. I can understand the way they're thinking, but I cannot understand they don't know about the right.
It's an extraordinary abuse of power.
I don't know. I cannot say that.
At a most vulnerable time.
I don't know. But in Asia Pacific, no one go to the court like our colleague in Africa, because they're still afraid of stigma. They're still afraid of disclosure. And then they're also afraid, if I go to the court and everybody know and I got divorced, and who wants me? Nobody wants me anymore because I sterilization already, and then there's too many. How about my children in school? Yeah, and also a few months ago, my child, 4 years old, almost kicked out from the school because I'm on the television, and then this happened in this year. And then I just go to the school and I say, you want to kick my son out, and then I will sue you. That's all. Because I have a right.
but baby, that's
oh my God, it's
a
not
horrible
indictment.
Yet. 30 years on from.
I know, I'm tired also to become
HIV
HIV positive.
Of course.
In this year, my son, this stigma is already 30 years. Can you imagine?
Well, I admire your ability to stand up and to take that stand. We're pleased that you do. The US has some interesting laws around childbirth, and by that I make reference to the ever-changing landscape around a woman's right to take control of her own reproduction. How does that integrate or play out within HIV and politically?
Well, it's hard to always to speak in generalities about the United States, since there's 50 states and the laws vary so widely, you see states like Tennessee that just passed a brand new statute that criminalizes any number of activities by a pregnant woman. Like any drug use is going to be a criminal offense.
Right, that'll stop that. Yeah.
And it's going to be terrible. There have been criminal laws used against pregnant women, and for the most part, it tends to be poor women, young women, black women, women who are already really struggling. But Tennessee is the first to essentially. I mean, there's going to be just. The opportunity for the authorities to launch investigations into miscarriages is just where we are on that.
Clearly, for their own good.
Yes, I mean I don't have a good answer. I can
nor should
tell,
you.
but I can't explain. Washington D.C., where I'm from, continues to permit pregnant inmates to be shackled during labor, which is a violation of human rights and has been said to be a violation of human rights by just about everyone who can. And some of our council members are working hard to get rid of that, but that continues to be a way we treat women when they're pregnant, it varies by state. It continues to be a great challenge. Again, with those intersecting sort of other social things that make them more vulnerable to coercion. Women living with HIV, particularly in the American South, I mean, really oftentimes have their doctors say, if you do not do what I say, whether it's you must get a C-section or you must not breastfeed, or if you do not take this set of drugs, I will report you to child services, and they'll take the baby away, or they'll take your existing children away, and that is a violation of rights. It's a horrifically paternalizing. There's oftentimes very good reasons that women want to make decisions, whether it's they're worried about taking medications because their partner is abusive and will find out they're positive, and they fear for their lives, which is a very real fear for many women living with HIV. And I would say, if you can make a blanket statement about the 50 states, I would say our legal system struggles to trust women.
That's pretty sad.
Yes.
And also we face the post-2015 new goals, and then the HR is not priority. Yeah, sexual reproductive health and right is not priority on post-2015 goals. So this is still happen till today.
Are we going backwards, baby?
And then I'm worried about that. Yeah, it is continuing the right, and then. But I'm happy I see that the gender equality is there, but how to link this all together? Because like you said, 30 years, I'm 13 years is already tired with this.
And just
situation.
Because we might focus on gender equality doesn't mean we can't take our eye off or shouldn't take our eye off the ball around these reproductive issues. It seems like you're going one step forward and two steps back.
Yeah. But this is a very important. Like we are in Asia Pacific, we need the research on sexual reproductive health and right now, because if we want to do the advocacy, we want to better changing situation, we need the evidence base. Yeah, why we need the sexual reproductive health? Why sexual reproductive health and right to be addressed and then can achieve the zero commitment? Because we implementing this in Indonesia is the last 3 years, and then we can prove, like a woman living with HIV now continuing to go to STI clinic, and then continuing to use the condom, for the sexual activity, but we don't have evidence can show this in Asia Pacific.
This is a major issue, these targets, these goals of halving new infections by 2015, which was the global commitment. Particularly when women are treated with an attitude of how dare you get pregnant, and how do they get past that to engage with the healthcare system if they're being stigmatised in such a way. And this happens extensively throughout the Asia Pacific region.
Yeah, but we still are advocating for the sexual education. Yeah, in the school.
Well, that's an international issue.
I know, but this is very sensitive in Asia Pacific, especially in Indonesia.
And culturally sensitive, yes.
Even we're talking about sexual reproductive health and right, in Indonesia, don't want to mention about this because there's boarding sexual. So the paradigm is sexual activity or whatever. So if we are, in my perspective, if we teach like my son, I teach my son, 4 years old, to say the the organ is penis and vagina. So from this stage of age, he knows the name, yeah. But mostly people not mention the real name. What's this? What this? And so we teach from now on, yeah. And then one day, and then we introduce about the relationship and this and that. But last year, the end of last year, yeah, in the parliament, they against what I say in the television because we promoting the condom that time. We no, we cannot teach our children too small to this. Yes, my children I teach already. Because if not earlier teach the sex education, even to know the sexual organ in his body, he can become like me. I don't want to.
The state of Texas trialled a terrific system around sexual health education for its teenagers, offering abstinence as the primary intervention for just about everything. And what that saw was record spikes in teenage pregnancy, I believe.
Yes. I mean, as Baby said, there's a lot of data we need, especially regional specific data on sexual and reproductive health and rights. We don't actually really need, certainly in the US, we don't really need more data. I don't want to say we don't need more data because my social scientist friends will
Fortunately,
hunt me down.
you've got creationism now being taught in schools in the US.
We always need more data, but we do have a strong evidence base on abstinence-only education and what it failed to do and what comprehensive sexuality education can do. And as Baby said, it seems very dry to talk about these UN processes and setting international goals, but it has huge implications on how nations set their priorities, and how nations set their priorities is what they spend their money on. And it gives activists and lawyers the opportunity to hold their governments to things. And right now, women were really left out of the MDGs, and we're fighting so hard not to be again. But the funny, I mean, it's not funny, but the Indonesian government is chafing at the term sexual. The U.S. government chafes at the word rights. So the U.S. negotiating position in the SDGs right now is sexual and reproductive health and reproductive rights.
I think this week.
Yep. We do not embrace the term sexual rights.
Because you don't have any? You have just about every other right in the US. You don't have these.
You're just thinking of gun rights, actually. And
the right to free speech.
Yes. The negotiating position from the U.S. government has shifted over the years. The current sort of argument for why we don't embrace the term sexual rights is there's no international consensus on a definition. So rather than propose or support an international definition,
let's get political instead.
We just sort of mince words. And the idea of us pushing forward an agenda for the next 15 years that doesn't embrace sexual rights, and it's important for people to know what that encompasses, because that's where LGBTI rights are. Correct. In a global sphere. That's really the only place they reside. That's the right to not be forced into marriage, or the right not to be forced into a sexual relationship. That's where FGM and the end of FGM and I would be. FGM and C would be.
Where does that work with this sexual rights issue? Surely that plays out in ways of sex worker trade as well.
It certainly does, and it has huge implications for women living with HIV. To sort of bring it back, I mean, that's where a lot of the right to have a sexual life, the right for it to be safe, the right to be free from violence and coercion, and I mean, this may be one of the big sticking points globally, but any good definition of sexual rights also includes pleasure. It includes a right to a pleasurable sex life, not just free from violence and coercion and degradation, but also an affirmative right to have a healthy and joyful sex life. And I think that's worth fighting for, and I think it is worth us being able to hold our governments to that, because there are very key pieces of the reproductive health and sexual health experience for all women and girls, but especially those living with HIV that reside within that.
When HIV took hold amongst the gay community in the early years, we saw a huge united community front push for political change. Why aren't we seeing that with regards to women's issues in HIV?
I cannot be. I'm not the spokesperson on that.
Your view.
I have some ideas. Part of it is many of the women who are most affected around the world don't have the time. They're busy with kids. They're busy trying to survive. And wealthy women in wealthy countries have always been able to access services and always will be able to access services. And we talk very much in an access to services way rather than a rights way. And I think it is still an ongoing struggle. I think, frankly, the developing world is doing a much better job of developing the dialogue around rights than the developed world is. And I think that's a significant power struggle right now, because, and I mean, honestly, not to get too wonky, but there's a lot of the Cold War left in that. The developed world sees rights as something that they're going to have to spend money on, and therefore don't privilege it. And much of the developing world sees rights as the groundswell that they can use to make a government better, and a lot of that is the sort of the former.
Back to basics in a lot of ways.
Yeah. So sorry to get so wonky on that.
No, I think you handled it well. Baby, would you like to see more engagement from positive women on this issue? Would you like to see a little bit of a push, maybe a bit of aggro, or are we beyond that?
Beyond
some protests, some outspokenness in this field.
I think I may not protest. I don't want to get scolded anymore.
When she says scolded, she means by the government.
The government.
Right.
Yeah, I'm better to work hand in hand with the government. So I'm better to make them listen, than go for protest. Many ways to get their attention in many ways. So we can do many ways in advocacy. But if this still happening in 2-3 years and they're not listening, I go to protest.
Good for you.
Yes, of course, for sure.
Are we making any progress? And what gains have we seen in the recent past and in the foreseeable future? What good things are being done in this area?
We not heard about the coerced sterilization again. Yeah, this is last. It's already 3 years. Yeah, we advocated for this, and then now we heard that stop but we still continuing with the monitoring system on PMTCT program services, and also we can see that women can say no. Yeah, I choose not to being sterilized. Yeah, I still want to have a baby and give an option for the family health planning. So this is a better situation now. This is a better situation. But I hope with the I think Indonesia with the new election, new government, I hope will be better than now.
What have we learnt from the South American countries with regards to this?
I don't think either of us probably feel comfortable talking for our colleagues. Is that true, baby?
Yeah.
Yeah.
But in loose terms, there have been some positive advancements in this area, have there not? Around community-based research and engagement.
Yes, I mean, there's always good stories, and there's always good stories that come out of oftentimes pretty egregious rights violations, and I think we have some great colleagues who have done work on sort of how do you create sort of women's groups and women living with HIV groups, especially. The epidemic is always a challenge because it's so different everywhere, and so being able to engage rural women, which is where a lot of the epidemic is in some countries, can be a real challenge, and I think some of our colleagues have really great examples of doing research that almost also serves as a advocacy galvanizing tool. And there's some hopeful signs there.
Yeah, and also we finding in Indonesia that when we are increase awareness about sexual reproductive health and right, and then also increase knowledge for women living with HIV about these issues, and then the new finding is violence against women living with HIV in all form. So we are now confused which one the priority for us. And then we develop a new program to integrate the violence against women and HIV. Now we implement this as a pilot in Asia Pacific. Yeah, but we know this is sexual reproductive health and right issue, not a violence issue. But the finding is a violence. But we address the violence first, and people still debating about the sexual reproductive health. So what we can do with this situation? I hope all government in all country want to listen to us about sexuality, about the right, our right to have pleasure in sexuality, in sexual activity as a woman living with HIV. My body is my choice. I can choose even though I say I want to marry 5 times, so what? I want to divorce now, so what? I want to have a baby more, so what? Only God can judge me. Only God can stop me. No one can stop me. Right?
It's
no different to the argument for gay men.
Yes.
Yeah. It really isn't.
No,
it really isn't.
It really isn't, and I think there's a lot of really hopeful signs across the world. I mean, I think the fact that women are suing in Kenya is a really good sign.
It's a pretty gutsy move.
Yeah, it's a bold move, and they have fought really hard. I think the fact that that forced sterilizations appear to have dropped off very significantly in Indonesia is a great sign. I would also say, respectful maternity care for women living with HIV is much more than simply like not forced sterilization. There's more to it. There's being given all the information and being allowed to make your own choices, being given the good data. And I think, frankly, the stuff that the doctors are still giving really bad information. They give very conservative information to women living with HIV about sexual activity, and I think that's sort of across the board in how doctors talk to people with HIV. But around childbirth, they're particularly conservative and not necessarily reflective of new data. And I would also say I would be very remiss if I didn't say that our colleague Tamil Kendall, there's so much that needs to be researched around maternal health and HIV. The list of what we do not know is overwhelming. Women living with HIV continue to have maternal mortality unrelated to their HIV infection, as far as anyone can tell, at many times what other women have, and we don't know why.
That's concern. That is a major concern.
It's a major point of concern.
Yeah.
We need to put a lot of money into understanding better maternal health and HIV. Beyond prevention of mother-to-child transmission, we need to understand it and how what it has to do with a woman's health, woman's reproductive system, and just getting at the maternal mortality aspect, but then the morbidity as well. The HIV infection and the disease progression. There seem to be some relationships between pregnancy and disease progression, but we don't know enough. We just don't know. The list of what we don't know is so long, and
yet
so,
there are more women living with HIV than men.
Yes.
Yes, and also based on our research study in Indonesia, the doctors say they needs to increase the knowledge or capacity to give more option to contraception for women living with HIV. Mm-hmm. Because in the guideline now and what we implement now, there is no option for contraception. Yeah, so I think the coerced sterilization is the best option beside condom.
No,
I think no.
Sterilization with choice is the best. Coerced sterilization is never
that's
the
why
answer.
this happened a few years ago, right?
Because they thought it was the best option.
And then based on this research, the doctor confessed that, so we need more capacity on this contraception.
Has circumcision come into this debate with male children born of HIV positive women?
Not that I'm aware of.
Right. It's a conversation that they have on a community level much later on. In Western cultures, circumcision has been one of those things that has been fad-based, pretty much, unless it's religion. Mm-hmm. But the way it's played out throughout sub-Saharan Africa with regards to HIV, I just wondered if it was part of the conversation.
That's actually a really good question. I don't know. The way we talk about it is always voluntary male circumcision, and it's of course not voluntary because children can't consent, newborns can't consent.
No, but it's much easier to do it then than it is 20 years later.
I don't actually have any. It's a really great question. I don't have any knowledge about how that plays out. Do you, baby?
No, but for my perspective in my country, and I'm Muslim, there is some. You must do that. Yeah.
But that's cultural, nothing to do with HIV.
But we know that circumcision for the male is very important to prevent a lot of disease. Yeah. So I can see that a lot of people to do that, not because of the culture, not because of the religion anymore. Yeah. But the female genital mutilation is stopped already since last year in Indonesia.
That's
a good Ministry
That
of
is great
Health.
news.
That's why
That
I
is
told
great
you
news.
we have a good Ministry of Health.
Well, baby RIVONA, thank you very much for joining us on this webinar series. And BEIRNE ROOSE-SNYDER, thank you very much for joining us too.
Thank you.
This has been the AIDS 2014 Global Village Connect webinar series. My name's Dean Beck. Thank you very much for joining us. Thank you.
You ask really hard questions.
Yeah. This is a dummy. Make me dummy for 1 hour.
You also
Sorry.
lucked out because I'm literally one of the only people who work on women's health in U.S. foreign policy who has any background on HIV and women in the U.S.
Right.
I might actually be the only one.
Oh,
All
wow.
of those questions would have been just like, I don't know. But I represented women in the South who were sterilized without consent. I didn't mention this, but Texas, one of my favorite Texas laws, is it is illegal in the state of Texas to attempt a